Good afternoon, or should I say good evening, or maybe I could say bonne nuit. I've been learning different languages to occupy my brain. Anyway, welcome along. Today I'm going to have a little bit of a chat to you about something completely different, but I do sometimes get asked this question, and it relates to pain in pregnancy. So this is for my friend who I have already sent her the information and stuff like that, but I actually come across some other really good tips while I was putting an order in actually for some skincare from Veda, and I'm going to talk to you about that as well today. So today is a little bit more of a herbal plant type talk around helping with lower back pain, you know, that pain in the pelvis area, and just the pain that you experience when well, for some people it's probably could be the whole time, because your body has to morph and change, right? So everything has to spread, twist, turn, move, and the body, like we talked about already, is pretty intelligent, so it'll know what it's doing, and you sort of don't have much choice. So all right, lower back pain, a little bit of that pelvic pain. This is muscular, or actually it's skeletal. Let's say skeletal, because it can be a touch of bone pain in there as well. So it'll be joint, muscular, and bone. And this is the pain that comes from the stretching, the moving, and also the weight and the heaviness. So for some women, they'll experience this more so of an evening or an afternoon after they've been on their feet doing all their work. There's a lot of really good yoga that you can do for some of that, and we've had a chat about that. You can also look into feet up the wall, and if you are someone who's been working with yoga for a while, and you've been working on your headstands and things like that, you know, having your feet literally up or hanging upside down is actually pretty good. Anyway, the other thing you could do is maybe you look into aerial yoga, but a lot of places will have classes geared towards that. So let's have a chat about herbal remedies and stuff like that. Now, my particular friend that I was talking to, she's got about 6 weeks to go. So she's doing her best to have a medication-free experience, like she has had in the past with some others. So she has essential oils that she's able to utilize, and there is a lot of talk out there about don't use this and do use this and all that sort of stuff. But I will go back to what I say quite a lot, and that is to trust your body, okay, and to get to know your body. This is her third or fourth baby, I think. So you know your body, right? And this goes for everybody. If you don't know it very well and you're just starting on that journey, then you need to get to know it and just trust yourself. So if I'm telling you something that just doesn't quite feel right, then maybe it's not information for you. But always trust yourself. Don't always go outside searching for answers, because you're going to get a lot of mixed information, especially when you use Google or Dr. Google or whatever search place you want to go and look at. There's a lot of places now. You will get very mixed information. So what I talked to her about was essential oils that you can use, and you can apply them across your lower back, but also you can apply them on her, she can apply them on her hip area and her lower abdomen. You need to remember that when you are working with essential oils, less is more. So 1 drop to a tablespoon of carrier oil. Think of it that way, okay? So I think it's 1 to 5. 1 drop to 5 mils might be about right. Only because I can't remember the measurement of a tablespoon off the top of my head. So you want 1 drop of essential oil, remembering that $2 shop or reject shop oils will not cut the mustard. They need to be good quality essential oils. 1 drop to that 1 tablespoon, and that's okay. All right, so if we work on a 5 or 10 ml dilution with a carrier oil. Now, your carrier oil, choice of carrier oil can be interesting. You can use I nearly went to say one that I probably will get myself into a lot of shit for. You can use some really good ones. One that I tend to like to use a fair bit is black sesame oil. You can also use almond oil, coconut oil, fractionated coconut oil, jojoba. There's some carrier oils that you can use that will help you, okay? And you want to massage gently onto that area. Now, less is more, but on a more consistent basis. So what you can do is you can mix up your blend in a little dish, in a little jar, in a roller bottle if you want to, and you can apply it topically throughout the day, across the day. And you should start to feel a bit of a benefit within a few hours, within minutes sometimes. And if you continue the process across a few days, you'll actually find that you shouldn't have that real strain or that real issue, okay? But by all means, reach out. All right, so what I talked to her about last night was using, there's a blend that doTERRA does, which is called Aroma Touch. Now it has marjoram in it, peppermint. Some of these essential oils and plants you're going to be told not to use. Why? Because people are quite concerned about them. And clary sage in particular is one that can support you. Definitely use that when you're going, when you're ready to have the baby. And I'll show you a point in a minute that you can massage that onto and use as well. But you need to not be scared of things, okay? They tell you to stay away from plants in the mint family like peppermint and stuff, but peppermint will assist you with nausea. Peppermint will assist you with digestive issues. Peppermint will assist you with so many different things. So will ginger. So get to know your body, be comfortable, and if you're worried, work with a therapist, okay? You can work with an aromatherapist. There's lots of us around. So Aroma Touch is a really good blend, but what I suggested to her was copaiba. So copaiba, and I'm using the general names here, okay? So copaiba is phenomenal for digestive issues and urinary issues. So with some pregnant women, they get urinary tract infections and stuff like that. If you're utilizing copaiba and rubbing it on your lower abdomen, along with, remember, dilute it, but rub it on your lower abdomen or your lower back along with lavender, and it will actually help to support you through the whole lot, through the whole journey. And it will help you in relation to that urinary tract issue, okay? But for the pain, lavender and copaiba with a carrier oil, fantastic, okay? You can use that for any pain. Doesn't even have to be for pregnant women, but in this particular case, this is what I would talk to her about. Why? Because she wants to be able to support herself, use what she has. Her husband's happy to give her a massage on her feet and her lower legs and her whole body if she needs it. He rubs her back, all that sort of stuff. Fantastic. But if you are on your own, you can do this as well, okay? But they are ones that I know through a lot of research studies and through experience with a few ladies now that they help quite a lot. So copaiba and lavender with the carrier oil, and you can massage topically onto the areas. So that's the lower back and on your hips and your lower abdomen, if you like, a few times a day, okay? And see how that works to help you. Now, peppermint in water, putting your feet in a bath or a foot soak, or even just get a bucket. Those water bottles, you cut them in half. There's one for each foot that way, but you can put your feet in water of an evening, and you can put just a drop of peppermint. You can put a drop of grapefruit in there as well if you want to, and just soak your feet. And if you soak your feet for 10 to 15 minutes, 20 minutes is perfect. And then when you take them out, they feel really cool and really refreshed, and that just helps to support your system, bring that core temperature down, and peppermint helps with pain. Okay, so you got those ones. Now I did actually pull out a book just to have a look. Another one that's really, really good is rosemary. So again, going back to that Aroma Touch blend, the oils that you need to assist you with cramping, with muscular pain, that sort of thing, they're in there. That's a blend, okay? Another blend that they have is called Ice Blue or Deep Blue. I think it's called Pain Away in a company called Young Living. There's no reason why you can't work with that as well. Frankincense is fantastic. So I'm pretty sure from memory the blend that I gave her is a good all-rounder. Bit of a cheat like that, but it's frankincense, lavender and copaiba, just a drop of each with some carrier oil and massage on. Now when it comes time to actually having the baby, you're ready to so many different things I can say with this, right? But you're ready to get that thing out of there. I'm going to dip a little bit into some Chinese medicine that I have been learning or had been learning as well. So you want to have a think about calming yourself down for starters. So copaiba and lavender again, fantastic for calming the nervous system, just for keeping everything neutral. You can use diffusers. A lot of places will let you use that, but you can also use it yourself. So topically you can put it on, but you can have it diffusing, okay? The other thing you can do when you're ready and in the lead up to it is to start massaging your feet and your lower legs, but paying particular attention to your inner ankle and about 3 inches above the inner ankle bone, okay, on the inside of your leg. It is called spleen 6. So this is a point that is contraindicated in acupuncture for pregnancy. Why? Because it will bring on labor. It brings on the bleeding aspect. It's the point where the spleen, the liver, and the kidney meet each other. So in terms of the energy flow through the body, it's where the 3 channels meet each other. So the 3 yin channels of the leg can be supplemented through spleen 6, regulates the chi within the 3 lower yin. I've got to be really grateful for the training that I did do with this. It's really, really good. It softens hard masses, calms the fetus, and also expedites labor. So there's a whole heap of other stuff there that it does, but in this particular case, it's what you want to think about. Also, you can also use it with prolapse. But so spleen 6. Now I'll just show you this little picture. It's a picture of the foot, okay? There's the inner ankle, and you've got about 3 inches up is your spleen 6 point. Most people you'll probably find will be a little bit sore, but you can use your oils and massage them on there. Now, the only thing that I would add to that combination, frankincense, lavender, copaiba, would be clary sage. Or you could just use aroma touch and clary sage. It will just really help to calm your system down. Clary sage is also the oil of a clear sight. It's your third eye oil. It's just going to open everything up and assist you with that whole experience. Now, the other thing that I had to share, which I probably didn't talk to her about yesterday, no I didn't actually, is you can actually get an oil. So this is for all you pregnant ladies out there, from Omveda, so Omveda, and you can purchase it in a little retail box. It comes like this, okay? You can buy it online. Beautiful packaging, beautiful little bottle, okay? The one that you get, this is a different oil, but the one that you get will be red as well. Why? Because it's got red fig in it, and it's also got Indian madder, which is from the coffee family, but that's a root that they use, so they process the root. Omveda is a really good business, a really good company. Yasmin works with people from where she comes from to put all these products together. So they take a while to make because they are made in the traditional way, and yeah, they're quite good. But this particular one is called Prasua Natal Care Oil. Prasua, Prasuya, sorry, Natal Care Oil. And it is a blend of herbs and spices which are mixed together in order to help you in pre and post labor, okay? So the wording for this is that it helps to maintain healthy skin, reduce stretch marks, and give relief from aches and pains. For prenatal care, gently massage part or the whole body from 6 months of pregnancy on to help get relief from cramping, pain, lumbago, varicose veins, and stretch marks. And as postnatal care, use from the 3rd day of delivery onwards. Unless you have a cesarean, if you've had a cesarean, wait for the wound to heal. This helps you with the pre-delivery fatigue. And in terms of your fatigue, you can use cypress, grapefruit, spruce oils, you know, that sort of stuff. Now, what is in that particular blend that is really, really good? Red fig, like I said, there's a Bengal quince. Now, I'm using the common names. The Indian madder that I talked about, dill, which is actually really good in terms of having anti-inflammatory properties as well. All of these are anti-inflammatory. Garden cress, which is a bit peppery. It's a little bit related to mustard and things like that. So the pepper helps with your circulation. The peppery side of things. It's also rich in vitamin K. This is garden cress, really rich in vitamin K. It's a sativum plant, so yeah, anyone that knows botanical names will know some of the others that it's related to. But the garden cress also supports bones, so I feel that that's probably pretty important when you're working with a body that's beginning to really change. So other places where this might be really good is working with shin splints or growing pains in kids, I feel anyway. So the red fig, Bengal quince, Indian madder, Bermuda grass. Now, Bermuda grass, side note, is cooch. So in Australia, we know cooch grass is shit. It just runs everywhere. Well, now I've finally found the use for it. The other day I was in the yard thinking, what can I do with this stuff? It turns out that the way that you do it is you sort of cook it up, use it as a juice. But yeah, it's really good for pain as well. Dill, garden cress, and turmeric. So turmeric was the spice that I was alluding to that's in this particular blend. All the rest are herbs or little shrubs. And that turmeric really helps with the inflammatory side of things on multiple levels. And it just helps us to relax, and that's what you want when your body's going through such massive change, because if you're relaxed then your baby's relaxed. Better process. And it's all mixed up in sesame oil. So I'll pop a link, I guess, or the wording for that in the description of this video. I'm all over the shop today. But I'm doing a video a day, like I said I would. Just let me check this for a second. Pain relief. Pregnancy and labour. Now, I got this book off online. It's actually been quite a handy little reference point in terms of helping me with learning the plants really well. Where are we? Eat leeks during pregnancy. So this book is called The Lost Book of Herbal Remedies. Some people probably scoff at it, but it's actually quite good. It doesn't have everything in there, but it's got a few. Leeks contain high levels of folate. So I know a lot of ladies who will go and get the pregnancy vitamins. Sorry, my phone just switched because I've moved to the new office, by the way, too. Which means I'm in the front room. So yesterday when I talked to you, I was in one of the back rooms. Now I'm in a bigger room so that I can do treatments and stuff from home as well. And I was up until midnight last night making sure that I'd moved everything in. Anyway, leeks have high levels of folate, which is beneficial in the developing process of the baby, and also helps with preventing some birth defects of the brain and the spinal cord. So that's just one of the vegetables that you can also use to assist you in the process. Anyway, I think that video is long enough. Post it up, share it with you. Hope you enjoy it, and if you need it, great. If you don't, no worries, skip on to the next video. I'll do another one tomorrow. But if you are experiencing back pain, experiencing any sort of musculoskeletal type pain, I would highly recommend looking into the use of some essential oil blends, because you can mix them up and use them yourself. Just remember the guiding principle that less is more. 1 drop of essential oils into 5 mils. Okay, so I would be talking about using lavender, copaiba, and frankincense. So there's 3 drops. So you'd want to ideally dilute that in about 10 mils of carrier oil, 5 to 10 mils of carrier oil, and massage that onto a healthy adult. If you're working with kids, you need to increase your dilution rate, and just remember, consistent application can help more than overdosing. Consistent application helps more than trying to put too much in, all right? Less is more when you're working with essential oils. Okay, I'll talk to you soon.